a lot of organizations have perhaps a superficial approach to problems when they happen. You know, we're often trying to find someone who's responsible, and we think rather naively, if we get rid of that person, everything's going to be fine. So only one instance I can think of where everything will be fine, and that's where that person set out in an egregious way to do harm. And I don't think many people do that. If we accept that that's not the case, and we're not talking about no personal responsibility here, but we need to look beyond that to understand what was that interaction between the individuals and the system in place. And that's a dynamic interaction over time that allowed a decision to be made that made sense to the person in the moment without the benefit, in this case, of seeing that the outcome is a child dying, and understand those factors. What support should have been there, or what factors were there that interfered with that, so we can learn from those decisions at a deep level and then use that to inform practice. And one of the exciting things, and it shows the kind of collaboration that the Commissioner sets the standard for, we will report this, and we're already talking about reporting much more frequently than the court accepted in our document. But a report is only the first step, you know, and that satisfies the public's right to know, but that doesn't accomplish anything. We have to have the recommendations that come out of that system inform practice. And we're looking at a number of mechanisms to do that. And one of the exciting things, and this is just one example, Scott talked about simulation training. We will take some of the findings from these real cases. So the tragedy of a child dying or nearly dying in Tennessee, the information suitably protected will inform the kind of simulation we will do real time with the investigator. So we're completing the loop so that what we learn isn't just in a report, and I don't mean to degrade the report, that's an important piece, but it's hardly sufficient. So we're looking at other ways of training our staff so that the real lessons we learn can change all the way from the decision making of that frontline staff person to our policies.